Okay, so hello everyone. My name is Angela Monaco. I'm with Walsh Duffield. We're here today for your annual open enrollment for your medical and your dental policies. As a reminder, that is a time to, make any changes to the current coverages that you have, come onto the insurance for the first time, or add, remove dependents, things like that. We have Carrie here from Independent Health. She's going to be helping us discuss the medical insurance. And then following that, I will be discussing your dental policies. And I'm going to provide my phone number to all of you so that you can call me should you have any questions that you don't want to, discuss on this call. But if you want some help choosing a plan that works best for you, if you have specific questions about something that's covered, feel free to give me a call. I'm available after this meeting, or really anytime that you have questions, feel free to give me a call. So if you guys want to grab a pen, I'll give you guys my phone number. It's 276-8036. So I'm working from home right now, so that is my home number. But feel free to give me a call whenever you guys have questions. I'll help you guys out. So we might as well jump right into it. Carrie's going to start going through your open enrollment kit. That was the enrollment packet that each of you may have received that we sent over. So if you want to follow along with us, this is what we're going to be running through right here. Okay.
Thanks, Angela. And hello to everyone that's on this call. I don't get to see everybody, but usually I'm there every year. So I like this, that we could at least get together virtually. So I'm going to high level this packet because the plans didn't change this year. More than likely you're very familiar with them. But like Angela said, write down any questions if I haven't covered them, or maybe at the end of the meeting, we can discuss any questions you may have. But I'm going to go through it pretty quickly, some quicker than others, depending on how much the information is. And just keep in mind that this is your packet. So if you want to look more details into any page that we go over today, please do so. As you know, your enrollment is for September 1st. You have 3 plans that are being offered. And at the end of this packet, it'll show you the highlights of the 3 plans that are offered. There's our IHA red shirt that just tells you that anytime you're a member, you can always call our member services number if you have questions on an explanation of benefits, a claim, how is this service covered. You want to always reach out to member services. They're your first line of defense as far as getting the information and knowledge that you may need. And also, if you're new to Independent Health or looking at the plans, you can always call the other number and we can talk to you through the plans that are being offered through the Institute. So as we go through this packet, this is basically the outline of everything you're going to find in the packet, and goes into the different type of health plan types and just understanding terms. In this day and age, there's things like deductibles, co-insurance, co-payments. What does it mean for first dollar coverage? What's my out-of-pocket maximum? Just things like that. There's just different plans. So this is a packet that not only speaks to your plans, but it speaks to all the plans that we offer. So not necessarily you'll have a blended plan that's offered or a plan that has co-insurance, but you could at least understand what those words mean. So for the deductible, this basically tells you that when you're in a deductible plan, you will be paying for the contracted rate for those claims when you use those services. And then once the cost of the claims meet the deductible, then it reverts to co-payments or co-insurance and things like that. So it's just telling you how it works within the plan. Once you reach a deductible, like I said, you're gonna, either hit a copay or a co-insurance, but this particular page, you may wanna look at it later. It just basically says if you have a $2,000 deductible and then you go and you use services and you hit a certain dollar amount or you hit the $2,000, then it reverts to your $20 copay if that is part of your plan and what you need to meet as a member. Keep in mind that there's different plans with different deductibles. And then, of course, we have our value added, and this is actually, you're going to see this repeated in our packet quite a couple times, just because we really like to stress the importance of downloading Independent Health's app on your phone. If you're tech savvy and you have one of those fancy phones, which hopefully everybody does nowadays. Even I don't have a flip phone anymore. So you can download the IHA app, and you can look up doctors, you can track your deductibles, your claims, things like that. And along with that, there's many things as a member of Independent Health that you can access and get information on. You can choose your wellness benefit. You can, like I said, you can visit your PCP, you can join FitWorks, things like that. So choosing your wellness benefit, as some of you know who've already been enrolled with Independent Health for quite a few years, or you're just enrolling, you have an option no matter which plan you pick. You have the ability to pick either a $250 Health Extras card, or you can take advantage of our nutrition benefit. The $250 Health Extras card, the vendors are listed on our website, and you can use that $250 for like acupuncture, massage, vitamins, nutritional counseling, gym memberships, things like that. The nutrition benefit is our partnership with Tops Markets, where if you go shopping and you buy fresh fruits and vegetables, we like to reward people for eating healthier. So you'll earn up to $500 if you're an individual. So basically, if you spend $1,000 on fruits and vegetables, you'll get $500 back to go back to Tops. It's like a Tops gift card, and you can go back to Tops and use it at Tops for anything except for cigarettes, because it's supposed to be a healthy option. And then for families, you can, if you spend $2,000, you'll get $1,000 back in rewards throughout the plan year, starting September 1st on. So if you're currently a member and you've enrolled in either the 250 or the nutrition benefit, remember September 1st comes, you have to re-enroll again and pick which choice you want again this year.
Yeah, so just to follow up on that, as a reminder, it's either or, and you don't have to be the same come September 1st. So for this year, maybe in 2020 plan year, you had a $250 card. Come September 1st, you pick the new benefit, the nutrition benefit or the health extras, and it does not have to be the same from year to year. So you can use one and then use the other. And if you do have that $250 card, like Carrie mentioned, make sure you're using it by August 31st, if you have anything left on there. Otherwise, you will lose that money. So make sure you use that up before September 1st rolls around.
Yep, and that's a good point, Angela, about that's why we ask people to redo it every September. We don't want to make the assumption that because you got the 250 last year in the nutrition that you're going to want it year to year. So some folks will go, why don't you just automatically send it? But we don't want to take that assumption, and we just want to give you that choice every year.
And just one last thing, if you do have the $250 card now and you would like to use it again for September 1st, after you elect that benefit again, keep that same card, because they'll reload that same card after you have used it. So you don't have to get a new card every time you elect the benefit. Okay, so we can move on.
And there's just the instructions on how to log in at the bottom of that page. And we also have wellness discounts as a member of Independent Health. And I'm going to always continue to refer people back to our website, because our website has so much information that you can access about all these things that are in the booklet. But the wellness discounts are where you can maybe go and receive these services and get a discount and not even realize as a member that you get that. So if you go to our website, it'll show you where to go, how to access the list. So just keep in mind that you do get discounts as an Independent Health member. And there's just our little picture of all the things you can get discounts on. And as a lot of you all know, Independent Health is a local health benefits organization. And we just like to always continue to remind folks that we're not only here for our members, but we're indebted to the community, and we have a lot of partnership with different community partners so that we can keep, we're just very involved in Western New York. So it's just to let you know that we care about the city of Buffalo, not just our members. And then getting care, finding a doctor, you can go on our website. If you don't have a primary doctor, if you're looking at switching a doctor, you can go online, find a doctor. You just have to follow the prompts, fill them in, and then you'll be able to click on that doctor. Just keep in mind, if you're changing that doctor, you want to make sure you call member services, let them know that you're changing the doctor so they can change it in your system so that when you go visit them, the claim will get covered. And then, of course, our preventative services. I always encourage folks to take advantage of the preventative services. Those are your yearly services that you go for, your yearly checkup. If you're a female, your mammograms, pap smears. You're going to see a complete listing on here. You'll also see this listing also on our website. When you're going for your preventative services, the only thing I do ask that you just remember is that when you're at your providers, just tell them that you're there for your preventative, because sometimes if they do additional lab work, or if you tell them, you know, I haven't been feeling good, now it becomes a diagnostic or a sick visit, and then you'll be responsible for a copay or the cost of that plan if you're in a deductible. So even though you went for your preventative and you go, well, how come I'm paying? If anything went above and beyond the preventative, you will be charged for that. So just like to tell folks so that they're aware of that. And then knowing your healthcare options, this is especially important, especially when you're in a deductible plan. You can see the different costs of what it does if you go to your primary care or an urgent care place, or even the emergency room. This just kind of gives you an average cost of a claim. So a primary care doctor, if you're in a deductible plan, you're going to pay $97. Now that might not be the contracted rate, but that's like the average cost in Western New York. And that's going to come off your deductible. And then once you pay that, then it exhausts your deductible. But if you go and use your teledoc, which we're going to talk a little bit more later on in the presentation, it will cost you only $50 versus the $97. So you can see from this slide that the places that you go could actually impact your wallet as far as the care you're getting. Now, I just need to make sure that in case of an emergency, of course, you're bleeding, you think you're having a heart attack, you want to go to the emergency room. You don't want to say, oh, that girl told me to call teledoc, or, you know, I'm going to call the 24-hour nurse helpline. You always want to go to the emergency room if it's an emergency situation. And here again, you're covered for emergency care worldwide. So if you're traveling on vacation, you're covered for emergency and urgent care. There's our 24-hour medical helpline. There are nurses that can walk you through, help triage. So this is a situation where it's not an emergency. You're not sure what you're feeling, how you're feeling. You're not sure if you should go to the doctor. What should you do? Here's a few just little issues. They can give you information, talk to you about common surgeries that you might be having coming up, help you talk about medications and maybe their interactions. So they're just a nice resource if you want to reach out to them. There's no cost, and it's just as a member, you can take advantage of that. And then here's our tool to tell you that you need to log on to take advantage of so much information that you can access through your phone. You can see your ID card, you can chat with a red shirt from member services, you can find a doctor, you can view your claims. There's so much online that you can do by setting up your mobile app. And if you don't want to do it on your phone, you can set it up online on your computer too. I do want to stress that because not everybody likes to do things on their phone. Brooke is our companion that we offer to our independent health members at no cost. This is for folks that have health conditions such as diabetes, high blood pressure. That's how it started out, but they do support general wellness for a lot of people. They help you with meal planning, things like that, to help you meet and reach your goals when you are experience things like, you know, diabetes and high blood pressure. So it's just important. Like I said, you can download it on your phone. And there's no cost as an independent health member. FitWorks is, in the past, if some of you were around, you could get FitWorks points and things and get rewards, but now we just offer FitWorks so that you can continue to use it as a social platform to encourage other people. If you're going through some wellness activities or goals that you'd like to keep, you can create your own challenges and compete with your coworkers. You can have a journal. There's just different things. It's just another way to help keep you on track to make healthier choices. And this is the part that I was talking about, was telemedicine or teledoc. If you haven't already signed up for this app, you want to do this ahead of time before you use it, because they're going to ask you information about your health history. They're going to ask you so that they are aware of your situation. So when you do need to call them, they can just pull you up and they're already familiar with your account. But you can go to our website, you can set it up. It's pretty easy and straightforward. You can talk to a licensed provider in any state that you're in. Again, it's lower cost than going to the emergency room or urgent care. It's for, just like if that you think you have a sinus infection or you need to get a prescription filled, these docs can write a prescription, send it to the pharmacy, and you don't have to go into an actual building, but you can have a virtual meeting with the provider, or you can do a telephone conference. So it's really important. I think it's really a good tool to have, even if you never use it. It's just a great way to for convenience, and if you're on vacation, things like that.
Just to follow up on that, for anyone that's in a high deductible plan, this telemedicine might really be useful for you. As Carrie mentioned in the previous slide, the going to your primary care physician is a bit more costly than going through telemedicine. So if it's something simple like, you have pink eye, you have an ear infection, you can call and talk to a doctor. They'll get you a prescription over. And it's a simple process, 15-20 minutes tops to get everything done, and you can have a prescription, and you didn't even have to leave work and get it taken care of. So this is a really underutilized benefit that we want to really make sure you guys understand. It's here for you. If you know what's wrong and you just need an antibiotic or something, this is an easy and cheaper way to get it done for you. So just wanted to make sure you guys really understand how this benefit works. It's a great benefit that they offer.
Right, and it's not in any way to tell you not to go see your primary. It's for situations where, like Angela said, oh, I get my sinus infection again. I know what it is. I'm going to call Teledoc and save myself the time of booking an appointment, things like that. Or it's the weekend and your doctor's not in, the office. So it's not in any way to say don't go to your primary ever. We're just saying that this is a wonderful way to help you with convenience, and if you're experiencing regular things like sinus and pink eye, things like that.
Or even when you're on vacation. I used it once when I was on vacation. So you don't even have to be at home. They'll
Right.
send you a prescription to, whatever closest pharmacy you're at. So this is a good idea for, vacation or out of town as well.
And then Food Smart's just another app again. If anybody's been around for any amount of time, Independent Health is notorious for trying to get folks to just make healthier choices, and just small, simple steps like eating more vegetables and fruits, taking a half-hour walk on lunch, things like that can help you have a healthier lifestyle. Food Smart is there to help you with meal planning. You can do a virtual one-on-one counseling visit. This is all at no cost to you as a member. You can look up healthy recipes. You can virtually help. This can help you save some time in the kitchen and eating better by doing it too. We also have a tool where you can compare your RX costs or prescription costs. As you know, sometimes prescriptions can be one of the highest cost things that we end up utilizing in our healthcare a lot of times. This tool will help you look at alternatives. It'll give you the different types of medication. You can compare real-time costs. look at local pharmacies and see how much it would cost to go to that pharmacy over the other. Just keep in mind that you're not going to want to just, I want to use this generic. You're always going to have a conversation with your doctor that's prescribed that and say, you know, I was looking at this generic, or are there any generics? You know, I found that this might, you know, be beneficial. And always have your primary have that discussion, and then they can maybe write a new prescription and save yourself some money. In our online member tools, this is just once you set up that online account, you can look at your benefits, you have a health dashboard, you can look at your claims. I know I'm repeating myself, but it's just, we really feel like it's really important that our members understand how much access they have to continue to help with their health care. Not only, you don't want to just think of healthcare as just using it for claims when you need it. Of course, that's a big part, but we want to ensure that you stay healthy and you become healthier so that you don't have to, you know, use claims and be sick. You know, there's a lot of things that we can do. This is an explanation of benefits, or an EOB. This is basically what gets mailed to you when you have a claim. Service comes to you. It will have your name on it. It will have the date of service. It will tell you what the cost of that service was, both from a non-contracted rate, and then it'll tell you what you are responsible for. If you have more than one or two claims, it will always continue to, at the bottom of the last claim received, it will tell you where you are in your deductible and where you are in your out-of-pocket maximum also. And like I said, if you have an online account, you can view these explanation of benefits too. And the next 12 pages or so are about privacy and confidentiality. We don't take that lightly in independent health. We never did, but especially in the season that we're living, there's so much emphasis put on privacy of our members so that we make sure that there's nothing that we would do to impact your privacy or your situation. And just, if you go back just a little bit to that one slide, Angela, I just want to just view about the national pharmacy. You have a national pharmacy network that you have access to when you're on vacation. Things like Walgreens, Walmart, places like that. You can see the full list of our pharmacy network online. So if you're traveling and stuff, it will actually give you a copay like you would be if you were in the local service area. And then there's the drug formulary. Folks that are enrolled in what we call our community plans, such as Institute, you'd be in drug formulary number 3. You would view that drug formulary, you would search the name of the drug, and it will tell you what tier it belongs to. It's either tier 1, tier 2, or tier 3, and you're going to see that based on generic, or preferred brand, and then our non-formulary drugs. And then it gives you all the different definitions. So I'm not going to go through all this, but this is there for your informational purposes. If you have a question on why is this drug a step therapy, how come this has a pre-authorization on it, it will just tell you different things like that. Okay, now we're going to get to the part where you actually have the benefits, and this is toward the end of the book. And the first plan is FlexFit Platinum. I don't know if you want me to go through this, Angela, or you want me to go through the comparison. Yeah, we'll do the comparison, and then if anybody has any questions. But basically, this is the 3 plans that are offered, and you're going to see that on the FlexFit Platinum plan, you don't have a deductible, where on iDirect Gold Copay or iDirect Silver Co-insurance. Angela, can you just move the slide just a little to probably your right, my left? Or is it because the people are on? I don't know, let me just, oh, I could move it. Never mind, sorry. Okay, so that's the only problem with virtual, folks. We get to move you around the screen. So there's no deductible in FlexFit Platinum. On iDirect Gold Copay, there's a deductible of $1,250 for single, $2,500 for family. iDirect Silver Co-insurance is $3,000 for single, $6,000 for family. And when I say family, that could be a 2-person family. It could be an employee, spouse, and children, or it could be just an employee, no spouse, and children. Everything else would be single, is obviously not need to be defined, but that would be a family. There is co-insurance on only the one plan, iDirect Silver Co-Insurance, where once you exhaust your deductible of $3,000 or $6,000, it will revert to 20%. And where your out-of-pocket maximum is, every plan has an out-of-pocket maximum. And what that means is that between your deductibles and your co-pays, once you pay that amount out of pocket, whether it's $5,250 for a single or $10,500 for a family, it will be completely covered for the rest of the plan year. So starting September 1st, if you've hit that out-of-pocket maximum, let's just say it's February 2022. I know that sounds really far away, but it's not. And you've hit that out-of-pocket maximum between February and August 31st of 2022, you will not have any more co-pays, deductibles, co-insurance, or anything once that out-of-pocket maximum is met. As you see, preventative services, as we talked about, are on all plans. Primary office visits are just a little different under the FlexFit Platinum, which is what we call our richest plan that we offer. And it's not because the benefits are richer, it's because the co-pays are the least amount that you're going to pay as a member out of pocket. However, it's going to be the most costly from a paycheck contribution. So it's a personal choice. And what the Institute has done is given you 3 wonderful viable options that, depending on your personal situation, your financial situation, and your comfort level with deductibles, you have an option here on which plan to pick. So with your primary doctor, it's $10 on FlexFit Platinum, $20 on iDirect Gold copay, and then of course it's 20% once it's the Silver Co-Insurance plan. And I just want to highlight the iDirect Silver Co-Insurance. All these services are going to say deductible then 20%, deductible then 20%, where on the FlexFit Platinum, it just has a copay. So keep in mind on the iDirect Silver Co-Insurance, remember you're paying the contracted rate for that service, and then that gets subtracted from the deductible. And then once that's completely exhausted or done, then it reverts to the 20%. And that 20% could be lower than the iDirect Gold copay or the FlexFit Platinum, depending on the service. So the specialist office copay is $40 on FlexFit Platinum. And then here on the iDirect Gold copay, it says deductible, then a $50 copay. So you can see on the iDirect Gold copay plan, you have certain services that what I call are prior to the deductible. So you have your primary visit, you have your emergency room, urgent care, ambulance, things like, and your prescription that will all fall outside the deductible. So if you're enrolled in this plan, you're going to pay a flat copay for those services, where on the other services under this plan, you will have a deductible and then a copay. Where on FlexFit Platinum, you have nothing but copays. And then on the iDirect Silver Co-Insurance, you have everything that you have to meet until the 20% co-insurance. So I'm going to skip down to the inpatient hospital, where it's a $500 copay for FlexFit Platinum. Here it says deductible, then a $1,000 copay. And I just wanted to explain that / admission. What that basically means is that you're going to pay that copay per admission unless it happens within a 90-day period from your last time you were in the hospital or visit. It doesn't have to be of the same I lost my word here. Then if you end up in the hospital, if you get admitted to the hospital and you're having, I don't know, knee surgery, and then 60 days later you end up in the hospital for something else and you have to stay overnight, you're not going to have that copay because it's within that 90-day window. But if it's 91 days, then you're going to pay another copay.
The rapid readmission is what I think you were trying to remember. Yes.
Sorry. Yep.
So it doesn't have to be the same medical condition. If you go back into the hospital for a second time within a 90-day period for any reason, if you're admitted a second time, the cost is going to be waived for the second admission.
Correct. And then routine radiology, you're going to have a $40 copay. And then on the other 2 plans, you have to pay the contracted rate till that deductible is exhausted, and then it reverts to either a copay or co-insurance. Advanced radiology, so routine is, just like an x-ray, things like that. where advanced would be your CAT scan, MRIs, things like that, where it's going to be a little higher copay. It's like, again, a flat copay on FlexFit Platinum, and then the contracted rate, and then it reverts to copay or coinsurance. The prescription plan is how we talked about it just a little bit before. It's 3 tiers. It's $5 for tier 1, $30 for tier 2, and then 50% for tier 3. And basically that is your tier 1 generic. Tier 2 is your preferred generic. I'm sorry, preferred generic is tier 1, generic on the second tier or preferred brand, and then other brand, and then non-formulary drugs on the third tier. You can see the iDirect Gold copay has the same 3 tiers, except they have just a little higher copays for those prescriptions, even though they fall on the same tier level. And then with the Silver coinsurance plan, you're going to see where each one of those tiers is a percentage of the cost of that prescription drug. And that's where your treatment cost estimator may come in helpful to you to see what the cost of the actual medication is. If you get a generic or brand, it might save you a little bit of money. Everybody has your routine refractive eye exam. That is your vision exam. That is if you need glasses, if you have to go to an ophthalmologist. It's a $20 copay across the board, no matter which plan you pick. All kids are covered up to age 26 under this plan. So if you have a child that's turning 26 October 15th, they're covered to the end of October and then taken off the plan. So that was a lot of information. I don't know if anybody has any questions or put anything in the chat.
I didn't see anything in the chat. I actually just had a quick question. Who is your vision network at this time? Is it IMED?
IMED, yep.
IMED.
It's still IMED. And
okay.
One of the slides that we looked at, it shows you that when you go to our website and you look for a provider, at the bottom of that list, it will give you a link to IMED. It will give you a link to different ancillary companies that we work with.
Okay, great.
So
So
this is just the full-blown benefit summary where it gives
I was
you,
just getting to the vision benefits so people can kind of see them. So what she was mentioning, guys, is make sure if you want these vision discount program discounts and benefits, you need to make sure that your vision provider is participating with the IMED network. And you could check and make sure your provider is participating by going onto the Independent Health website and looking them up to make sure. But just keep in mind, if you can see here, this is the FlexFit Platinum, for example, the out of network, most things are not going to be covered when you're out of network. The eye exam, it looks like it is, but it's going to be more costly. So just keep in mind that you want to make sure you're using a participating provider to utilize these vision discounts. So it looks like we do have something in the chat. It says, do any of these plans offer an HSA? So the FlexFit Platinum is not going to be HSA eligible. I'll have to check. I do not think the iDirect copay is not. And
no,
the, sorry, this keeps getting, and the iDirect co-insurance, I believe it is, correct, Carrie?
Yes.
Okay, yep. So you can, Catherine, so you can sign up for an HSA if you'd like. You could go to one of your banks and, you have to be enrolled in the co-insurance plan in order to qualify for the HSA, but you can go to a bank and sign up for an HSA account if you'd like. KeyBank is a popular one. It has no fees, and you can provide that banking information to your HR and they can direct deposit, on a pre-tax basis into an HSA for you. But just keep in mind, you do need to be an HSA qualified plan like you asked, which in this case, the only one offered would be the co-insurance plan.
And you'll see that on our plan names. It will say the name of the plan, and it will also be followed by HSA&Q, which is Health Savings Account Qualified.
Yeah, I think we have it somewhere here. Here we go. See right here, the iDirect Silver Co-Insurance HSA&Q. So that what Carrie was mentioning is the HSA qualified. So does anyone else have any other questions in regard to the medical plan before I start the dental information?
The only other thing I wanted to mention is there's an application at the bottom of the packet, and any folks that want to make a plan change for September 1st will need to fill out an application and determine which one they want to change to. If you're staying with the current plan that you're in, you don't have to do it. We're Independent Health's not requiring anything from you. We're just going to automatically enroll you into that same plan again for September of 2021.
Okay. All right, great. So this is the application. If you guys have questions on this, feel free to use that phone number I gave you earlier to give me a call. I can help you with it. And, you know, of course, if you don't want to ask any questions on this call, that's fine. I'll help you pick a plan if you're not sure which one is going to be best for you. So just, you know, follow up to me if you have any questions on that. So I'm going to go ahead and get started on the dental. Carrie, I think we're all set. If you can go ahead and sign off if you'd like, or you could stick around, whatever. But we'll
Okay,
get started.
well, I think I'm going to sign off.
Okay.
You know, not that I would love to stay here and chat some more, but my time here is completely exhausted as far as what information I can give you. So I hope everybody has a good rest of the day. It's nice to be with you virtually, and hopefully sometime in the future I'll be able to see you again in that beautiful room with those plants. So take care, everybody.
Right. Thanks,
We look
Carrie.
forward to seeing you in person too. Thank you.
Yeah.
All right, everyone. So let's get started on the dental. Your dental renewal is actually October 1st. So you have a little bit of time to decide if you're not currently enrolled on the dental plan, if you would like to enroll for the first time, or if you need to make any changes like adding a dependent or anything, you have a little bit of time to do so because this policy actually renews in October. So we'll go through the benefits. It is through Lincoln Financial Group. And it does allow you to choose any dentist that you'd like because it is a PPO plan. However, you'll save some money by using an in-network provider. So we'll go through some of the benefits here. And as you can see, there's in-network and out-of-network. So it has the two columns here. If you are staying at an in-network provider, if you're on an individual plan, meaning only you as the employee is enrolled, you do have a deductible of $3. If you're on a family plan of 2 or more, you have a $150 deductible. Now, keep in mind that is only for basic and major services. Your preventive services that you go for, usually 2 times a year, your cleanings, x-rays, those are not subject to your deductible. So you do have an annual maximum of $1,000. So what that means is if you go for your basic and major services and they add up the cost of your services, you get a filling and you get more than one filling. For example, they keep track of how much you are spending towards this $1,000 maximum. If you reach that $1,000 maximum, nothing will be covered after that until your plan renews again on October 1st. So if you know you need multiple services and you want to make sure they're covered, maybe something can wait, something needs to be done now, you can time that out to make sure you get the best coverage. Your dentist will of course help you with this, getting a pre-treatment authorization and so forth to help you navigate that. There is a waiting period. So if you were a new hire and you would like to take the insurance right away, that will prevent you from having a waiting period. So as you can see, there's a 12-month waiting period. If you were elected, if you signed on for the insurance for the first time when you were a new hire, there's no waiting period. But if you did not take the insurance when you were first eligible as a new hire, there will be a waiting period for your basic and major services. So keep that in mind. If you're a new hire, you may want to sign up right away so you don't have these waiting periods. So for your preventive services, they're listed right here, the exams, the x-rays, the cleanings, fluoride treatment, things like that. That's covered at 100%. So you don't have to worry about paying for anything. Go get your services done and it won't cost you anything. And that's whether you use an in-network or out-of-network provider. For your basic services, here's a list of all of the services that falls under basic. Your basic services are covered at 80% after that deductible that we discussed in the beginning. Major services, here's the list of all of your major services. They're covered at 50% after the deductible. So major services are going to be a bit more costly. And of course, any of you who need a copy of this summary here, I will send that over to Marin to make sure you guys get a copy. I'm not sure if you received this or not. So I want to make sure I get this out to you so you guys have this, and I'll send it after this meeting, okay? Now, it looks as though when you're comparing these benefits, the in and out of network, they look the same, right? Out of network, 80% after deductible. Well, why would I want to use an in-network doctor, right? The reason you would want to use an in-network doctor is for this reason right here. Because what's going to happen is Lincoln's only going to pay the usual and customary fee. So what's going to happen is your out-of-network provider, say for example, you go for a service and it's $150, but the usual and customary fee according to Lincoln is only $100. Well, your out-of-network doctor can actually balance bill you for that extra. So if you're going for a major service and your coverage is 50%, then they're only going to give you 50% of that usual and customary, which in this example would be $100. And then you would also be balance billed for that extra $50 when using an out-of-network provider. So just keep that in mind. They are allowed to balance bill you any charges over and above the usual and customary rate that Lincoln determines is typically for that service. Okay. Now, of course, there are some exclusions that come with all plans, and you can kind of review them here on your when you get a copy of this. But that's pretty much it in a nutshell for the dental. Does anyone have any questions on the dental plan? I don't see anything in the chat. But I'm going to get this over to you guys. And of course, I'm here if you have any questions. If you need to enroll for the first time, make sure you're filling out those applications. I can help you with any questions on the applications as well. So for those of you that joined us late, I did provide my home number to give me a call so I can help kind of walk you through, any plan choices or questions that you have. So I'll give you guys my number again. I'm working from home. It's 276-8036. Okay, so you guys can give me a call whenever you have any questions. Okay, so I think that pretty much ties it up if no one has any other questions. Okay, well, I'm going to go ahead and stop sharing my screen and disconnect the meeting. So I hope you guys all have a great day. Okay.
Thank you very, very much, Angela. I very much appreciate this from everybody and for all of you who participated as well. So hopefully it got your questions answered. If not, don't hesitate to reach out to Angela. She will have the answers.
Okay, great. All right, everyone, have a great day.
Thank you.
Thanks. Bye-bye.
Angela?
Yes.
Well done. I think that went well. So
thank you.
yeah, so that'll be